In the U.S., African Americans are at a higher risk for heart disease than any other ethnic group, and it is leading researchers now at Ohio State Wexner to publish a new study on how to lower that.
NBC4's Jonathan Jackson is live outside of the Wexner Medical Center with the latest from doctors on this study. Jonathan, they say it required the help of dozens of local black men here in Columbus.
That's right, Jen. 74 black men all across Columbus participated in this study of all age groups and backgrounds. I talked with one of those men. He tells me this program not only changed his life, but very well may have saved it too.
I was 300 plus for over 2 decades.
When John Drummond was asked to participate in a study that would focus on black men's health, he says there was no question he had to make a change.
My health was dramatically and excessively and expeditiously failing.
That was almost a year ago when he was 385 pounds. Today he's at 240 and thriving. And he's not the only one benefiting from it.
What is important is that black men have a relationship with a medical professional. And what this did was, what we wanted to do is reduce that mistrust.
John Gregory is the founder of the African American Male Wellness Agency. He says in collaboration with Ohio State Wexner Medical Center, they took part in a team-based health study which focused on lowering the rate of heart disease in black men through several key methods.
By increasing physical activity and improving diet, decreasing smoking, and ultimately working on reducing body weight as well.
It literally means that it can be an improvement of 70 years of your life if you are reaching ideal levels in that metric.
Dr. Joshua Joseph and Dr. Tamaya Nolan are both assistant professors at Ohio State University who helped to lead this study. They say by performing a few lifestyle changes over the course of 24 weeks, they helped 74 black men here in Columbus improve their cardiovascular health, leading to a 19% lower risk of death. And it was all through team-based strategies involving positive reinforcement and community engagement.
This would not have been possible without them trusting in us.
And participants like Drummond say the same.
The fact that we could see that they cared about our welfare, I don't think the turnout or the outcome would have been the same.
And doctors at OSU say this is just the start of their research. They plan to continue their studies along with help from the community and the African American Male Wellness Agency. Local for you at OSU Wexner, I'm Jonathan Jackson, NBC4.